You ready to go? Go, buddy. One of the coolest things I've seen here yet.
Hello, my name is Grant, and I'm trying to live forever. I've lost over 300 pounds using the gastric bypass 16 years ago, and I've maintained my weight over all that period. And I'm hoping you can do too. So what we're going to talk about today, this is going to be a fun one. This is one of the good things about doing the process, and that's going to be the skin removal surgery after you're done. Okay, so the first thing I want to say about this is you're going to have to wait 18 to 24 months after you've had the surgery to get this done. And I suggest you wait till you've leveled off, which you're going to do. Your system is going to have a new set point, and you're going to be leveled off for at least 3 months. And the doctor's going to require that too. So he's going to require a weight level. And to get it medically necessary is if you have skin-on-skin contact, which I did after I carried most of my weight on my torso, so I had a pretty good skin flap after the fact, after losing all that weight. And if you have a large amount too, you will also too. And it's not hard to get the insurance to pay for it. Now, the one thing I would say is that if your insurance will pay for it, they're going to pay for just a simple surgery, just a skin removal surgery. And that's most of the times not done by a plastic surgeon. If you're lucky enough to get a plastic surgeon, he's going to do just a simple surgery, which is just a simple front side skin removal surgery. Now, mine turned out pretty good. I was very happy with mine. But women, I would suggest if you can afford it, make a deal. There's all kinds of ways to finance this. Have a plastic surgeon do your surgery, because the insurance is going to pay just for a basic surgery. A plastic surgeon is going to want to make sure it looks good and it comes out correct. So that's my advice. If you can afford it, if you can finance it, if you can do it, have your plastic surgeon do your surgery. Okay, and when you have the surgery, make sure you have contact information for your doctor. Make sure you get every pamphlet you got and you ask a bunch of questions, because I don't know if it's any different now, but when I had mine and Miss Christina had hers, we had ours done in Little Rock again, which again is 3 hours away. And it was a 2-night stay in the hospital then, which now they're doing as much outpatient as they can. So you basically come home, you wake up, and you feel like you've been punched in the stomach multiple times. You feel bruising, you feel sore, you feel scared to move. You've just had a large portion of flesh removed from your torso, and it's scary. It really, really is. That was the one thing I remember most about it was I was scared to move. I was scared to get bounced around. I was scared to get out of a chair. I was scared to stand up and be upright and be straight, because when you come out, your knees are up. You're back on the bed, and your knees are elevated, and you're sitting. You're sitting, but you're laying down, and that's the first 24 hours. And then you got to get up, and you got to try to, and it's scary. You feel like you're gonna just rip apart. It's not a fun surgery. It's not fun at all. It's going to be painful. It's going to be uncomfortable. There's going to be swelling. There's going to be there's going to be suction pumps on you. There's going to be blood. It's going to be rough. You're going to go through 6 weeks of it's going to be rough. Just know that going in, this is not a fun surgery. But on the backside of that, once you're comfortable and you look at yourself in the mirror and you see that body that you never thought you'd be able to see again, you see a relatively flat stomach. And for guys, if you've been a large guy and you see it, that's a big deal, okay? Because that's a big deal, okay? You're going to feel good about yourself. It is a wonderful, wonderful thing. One more thing. Do not buy clothes or do not revamp your wardrobe. You can buy a couple things, but don't buy a bunch of clothes till at least 3 months after you get to surgery, because there's going to be swelling. Everything's going to rearrange. It's going to shrink up. But if you buy it before that, it's not going to fit right again after all the swelling goes down and the fluids and everything evens out, because it's going to be weird. This surgery takes a long time to get finished with. It's best way to put it. It takes a long time to get completely healed from this surgery. It's going to hurt worse than the gastric did. And it's going to take longer for the pain to go away than gastric, because you don't think about just a surgeon coming in and cutting off that flap, that excess skin, but that's a big surgery. And your body is good. You're not eating as many calories as you were before. It takes longer to heal. So just know that going in. This one is not fun. It's going to be hard and it's going to be painful. And you're going to think, oh my God, what did I just do to myself? But if you can get through it and work through it, the results, it's worth it. But it's going to be rough. All right. I hope that helps somebody. Then it's just so you know what you're getting into once you get it done. That, none of this is fun. It's necessary. And some of it can be very rewarding, but some of it can be pretty rough. So I'm hoping you all do well with this. Listen to everybody, get online, get information, find out everything you can about it, but just know you're gonna have second thoughts about this one when you do this one, even more than the gastric. So it can be done. I believe in you. I hope everybody has a great day, because a great day today can be a better day tomorrow. Y'all be good.